आफ्टरनून, नमस्कार। मैं डॉक्टर कुलकर्णी आपसे अब मुखातिब हुआ हूँ बात करने के लिए अबाउट women who get pregnant after 35 years of age. Actually, we call it the elderly would-be mothers. मतलब हम जब कहते हैं कि elderly mother, तो इसका मतलब क्या होता है और आगे क्या करना चाहिए, इस पर मैं आपसे आज बात करना चाहूँगा. So I hope all of you there are listening, and we hope that this chat will help all of us to understand what exactly is this elderly mother. So first of all, हमें ये सोचना है कि rather than get into the definition कि elderly mother का मतलब क्या है, कैसे होता है वगैरह, just understand करिए कि अगर woman का age 30 के ऊपर होता है जब वो माता बनती है, तो जो प्रॉब्लम्स आते हैं वो शायद 25 से 30 के बीच में सिमिलर होने वाले थे, लेकिन जब उसका एज 35 से ऊपर चला जाता है तब कई प्रॉब्लम्स अलग किस्म के तैयार हो जाते हैं बिकॉज ऑफ हर एज. सो वी हैव टू अंडरस्टैंड दैट 35 इज अ कट ऑफ. बट एट द वेरी बिगिनिंग लेट मी क्लैरिफाई वन पॉइंट. ये 35 वाला जो कॉन्सेप्ट है इज मोर और लेस फ्रॉम अमेरिका एंड यूरोप. विमेन इन इंडिया probably age more than women abroad. So suppose we have what is called as a woman of 32 or 33 also. We consider her as more or less like a 35-year-old, or she'll behave like that. So I think हम ये discussion इस पे ना बहस करें कि हमारा age का जो factor है वो 35 के ऊपर का ही होगा. मतलब ये नहीं कि 34 अगर है तो आपको कोई तकलीफ नहीं होगी. Start thinking of yourself as a woman of 30 and above, which is a nice way of looking at this problem. Now, why is this happening? पहले तो उसका सवाल का मैं जवाब दे दूं. Generally, आजकल करियर पे लोग concentrate करते हैं. अपने जो है वो लाइफ में they would prefer to take up their jobs, to take care of other responsibilities. Settling down होता है. Sometimes there are late marriages that everybody of us knows of those. So whenever this starts happening, invariably the marriage age itself has got pushed up a little. Second, people may delay childbearing. People don't want to have children immediately after going for, settling into marriage. They have time to understand each other, which is also good. So what is now happening is this boundary of when you have your first child, पहला बच्चा कब होता है, ये थोड़ा आगे की तरफ जा रहा है. गए 4 generations में जो है ये मेजर चेंज आ गया. पहले जो हुआ करता था बाय 28 और 29 आपका पहला बच्चा हो ही जाता था. यहाँ पे क्या हो रहा है, 30 के बाद में अगर आप करते हो तो भी कोई दिक्कत नहीं. कई बहनों का जो है वो करियर ना हो, शादी भी ना हो, लेकिन जानबूझ के अगर उन्होंने डिले किया तो आज का डिस्कशन विल बी मोर फॉर दैट. सेकेंडली, हु इज एन एल्डरली मदर, जैसा मैंने बताया, एनीबडी अबाउट 30 वी शुड कंसिडर इन अ सिमिलर पॉसिबल. 35 के ऊपर है तो ऑल द मोर रीजन व्हाई यू हैव टू बी केयरफुल. Secondly, अगर you are in this group, so why are we talking in this group? Because इस group में we recommend not just treatment, not just taking care, but even beforehand you can plan. So in my center in Siddhi Life, we have a lot of counseling sessions which happen to people who get married. वो हमारे पास आते हैं immediately after marriage, before going for their honeymoon. They say कि भाई, let us discuss what is our future. So by future, they are not talking about their careers. They are talking about what we should plan and when should we have our baby. So ये वाला जो है is like planning. So we recommend that if we are in the elderly age group and we are getting married a little late, and even in the younger category, if you are getting married, it would be best to have what is called as a counseling session with your eventual doctor. Because we see a lot of people who could have been prevented from having complications अगर वक्त पे उनको advice मिलता. So my first take home is that if there is a woman who is in the 30 age group who's getting married, ideally they should come, both the husband and the wife, to discuss what are the plans and how they should go about. It is not just about this discussion that is important. What is important, we do some checkups for them also. These checkups can be to check whether she has any problems which are hidden, which we don't know. We can also check for endocrine problems. Last time मेरी बात हुई थी यहाँ पर, We had discussed about thyroid problems. This is a very common problem. There are two other problems which are quite commonly seen. Polycystic ovary नाम का जो problem है, PCOS, ये common होता है, periods irregular होते हैं, but इसमें जो है, it would be important that she undergoes some very simple treatment, some very simple corrective measures जिससे conception can occur naturally. So this is where we rule that out. There is always an important discussion जिसमें हम discuss करते हैं, is there a family history of any abnormality in their family, like children born with abnormalities, or is there a possibility of diabetes in the family, hypertension in the family, and other factors. So ये counseling session बहुत important होता है. दरमियान husband का भी evaluation होता है, उनको भी अगर कोई खामी है तो it is more like going into a situation forewarned. You're going into a marriage where you eventually want to have babies. Your doctor can help you decide a timeline. You need not stick to that entirely, but at least you take friendly advice. The second thing is, usually people ask us, is this a form of infertility treatment? So we say this is not. This is not infertility treatment. This is preventing infertility treatment. So if you are sensible, at that point itself, you can seek help. This is one part which I wanted to stress. So young couples who get married, in certain group of people, especially above 30, if the girl, and I'm talking of the girl's age, not the man's age, if we can go above 30 and up to 32, we give them anywhere between a year to 2 years in which they should plan to have a baby, unless there are other reasons. This is after a medical discussion. Otherwise, if you're 35 and above, please understand, generally 1 साल से ज़्यादा, more than 1 year, should not be taken if you eventually want to have babies. The sizes of the families have grown small. People don't want many children, but what they want are healthy children. So I'm coming to that part. One of the questions that was asked, and I'm just answering it often. So why is it important if a woman is 35 to start planning a baby early? सबसे important reason ये है कि the fertility starts declining after the age of 35. Now this 35 again in Indian women also, and for people who stay abroad. So agar you don't want to go to an infertility doctor afterwards, it'd be best to plan to have a baby within 1 to 2 years, 35 ke upar within 1 year. Secondly, an evaluation of the entire system helps us tell you कोई problem है या नहीं. अगर है तो ट्रीटमेंट उस तरह से दी जा सकती है. सेकेंड पॉइंट, अगर मान लीजिएगा आपकी इनफर्टिलिटी की ट्रीटमेंट किसी को फैमिली में हुई है या कोई फैमिली में प्रॉब्लम था बच्चे में, तो ये अगर डिस्कस करो तो योर डॉक्टर नोज ऑलरेडी व्हाट इज टू बी एक्सपेक्टेड. सर्टेन करेक्टिव स्टेप्स कैन बी टेकन. सिंपल थिंग्स विल टेल यू. हमारे यहाँ वील हैव पेशेंट्स हु कम इन जिनको अनीमिया होता है, पढ़ाई लिखाई में ध्यान होता है या काम धाम में पड़े हुए होते हैं. अब बाकी सारी चीजें तो ठीक हो सकती है. सिंपल सा एनीमिया अगर हमने करेक्ट किया, उसकी थकान चली जाती है, एंड शी बिकम्स हेल्दियर एंड हैप्पियर. सो दिस वाज अ पॉइंट आई वांटेड टू मेक. नाउ दिस इज कॉल्ड एज अ स्क्रीनिंग प्रोसीजर. We also have a counseling session where we discuss how you should plan and whether you feel that you can't अगर follow those things, कोई दवाइयाँ देनी पड़े. तो corrective measures के लिए मेरे पास वक्त होता है, हमारे fertility doctors के पास वक्त होता है. Third thing, ये स्क्रीनिंग के बारे में मैं कुछ कहना चाहता हूँ. अब if a young couple comes to us and they say we have just got married, we are hardly 1 or 6 months or even just married or 6 months है, and we would like to know more information about how we should plan for a baby. This is the best way where a doctor can become one of your counselors, your guides, and he or she can help you. In our center, Siddhi Life, we always encourage people to come in early, and most of the time they don't need to come back for treatment. You can log on to www.siddhilifeivf.com. That's the website where you can get this information. Now, the other part, most people will say, ki, okay, I'm 35 years of age, I have got married. Do I need to worry about you? Now, I'll tell you how we should plan. What I would like to do now is, suppose I say that you're 35 years of age and you have come at a point where you want to have a baby. If at this point of time कुछ इवैल्यूएशन हो रहा है तो सबसे पहले आपको ये डर है कि मुझ में कोई खामी होगी या नहीं, या कहीं पे कुछ गड़बड़ होगी. फर्स्ट ऑफ ऑल, डोंट पैनिक. It is not necessary that you can't conceive naturally. It is not that आप में कोई खामी है, ऐब है, या something is not going properly for you. All you have to understand is, in a major category of patients, an evaluation gives us a direction in which to go. Secondly, suppose I have to give a piece of advice to a 30-35-year-old, ये range वाली woman में, we would say maybe get an evaluation done जो डॉक्टर ने कहा है. अगर वहां पे कुछ मिला तो टेक कॉग्निजेंस ऑफ इट. आप प्लानिंग कर लीजिएगा, लेकिन ऐसे करो कि भविष्य में आपको प्रॉब्लम नहीं आए. सो डोंट पैनिक, प्लान एंड एग्जीक्यूट विद इन अ टाइम फ्रेम. सो सपोज इट इज 6 months, suppose it is a year, suppose it is a maximum of 2 years. A doctor can guide you for more natural ways. This will include pathways where suppose आपका career follow करना है, तो you can plan to take your career accordingly. कहाँ पे ले जाना है, कभी करना है, etc etc etc. So one part is over. Now let us come to a strategy. Strategy क्या होती है? अगर मेरे पास कोई कपल आता है जिसमें the woman is 35 and above, what is the evaluating steps I do and what are the things that I am looking out for? So the main part, when a couple comes to us saying that we are trying to conceive but we can't, or they come in saying that we would like to conceive at some point of time, but right now we are not sure about it. So what do we do? Normally ऐसे cases में हम लोग ऐसा करते हैं कि we tell them certain basic evaluation हमें करना है. That might be a sonography. In a woman's case, we generally ask for a blood test which tells us on day 2 or 3 of a cycle, periods के, whether the patient has adequate reserve. ये टेस्ट का नाम है AMH. ये टेस्ट हम जनरली करवा के भेजते हैं, वो बहुत एक्यूरेट है. इट इज रिलायबल. नाउ सपोज ये मैं टेस्ट करता हूँ, तो व्हाट विल आई फाइंड आउट? आई विल फाइंड आउट वेदर वी हैव टाइम और नॉट. आजकल इतने सारे पेशेंट्स देखते हैं जिनका AMH वैल्यू बहुत कम होता है एट अ यंगर एज. ये एक प्रॉब्लम है जो हम ज्यादा देखने लगे. आई डोंट नो व्हाई इट इज हैपनिंग, बट दैट प्रॉब्लम इज क्वाइट सीरियस. बिकॉज समझ लीजिएगा कि एक झाड़ है जिसको फल लगते हैं. ये फल लगने की क्रिया अगर मान लो 10 साल की है, तो 10वें साल तक आप वो फल खा सकते हो. अगर मान के चलिए यही बहन, इसके फल 5वें साल के बाद सूखने लगेंगे, अच्छे क्वालिटी के नहीं आएंगे, तो बच्चा होने के चांसेस हमेशा जो है वो कम हो जाते हैं, या उसके लिए हम एडवाइस देते हैं. तो अभी के लिए मेरा कहना ये है कि कुछ बेसिक ब्लड टेस्ट है जो आपके इनफर्टिलिटी स्पेशलिस्ट या गायनेकोलॉजिस्ट आपको बता सकते हैं. अगर ये टेस्ट आप करते हो तो यू विल बी इन अ बेटर पोजीशन टू नो व्हाट यू शुड प्लान एंड हाउ यू शुड प्लान. सो AMH इज वन टेस्ट दैट आई वांटेड टू टॉक अबाउट. सेकेंडली, हम कुछ स्क्रीनिंग भी करते हैं. स्क्रीनिंग का मतलब ये होता है कि कुछ डिसीजेस होते हैं जो जनरली आप में हो सकते हैं लेकिन पहले आपको पता नहीं चलेगा. तो स्क्रीनिंग का मतलब ये होता है कि कुछ डिसीजेस जो है अगर बच्चे में होने वाले हैं, कई बार हमको पूछा जाता है सेम ब्लड ग्रुप है, क्या फर्क पड़ेगा? कुछ नहीं फर्क पड़ता. ये गलत फहमी है लोगों में कि सेम ब्लड ग्रुप के होंगे तो तकलीफ होती है. ऐसा बिल्कुल नहीं है. सेकेंड थिंग वी हैव टू अंडरस्टैंड इज कि इन केस हमने स्क्रीनिंग कर रखा, अगर मान लीजिएगा कि हमने कुछ हमारी टेस्ट्स की, वैसे लोग पूछते हैं एज अ कपल व्हाट डू वी आस्क. सो वी आस्क फॉर व्हाट इज कॉल्ड एज अ सेमेन एनालिसिस. ये मेल्स के लिए भी इंपॉर्टेंट है. कई बार ऐसा होता है हम फीमेल्स की तरफ ध्यान देते हैं लेकिन मेल्स की तरफ हमारा ध्यान नहीं जाता, which should not happen. We should also look at the males because there may be a problem there which we don't know. Often enough वहाँ वो पकड़ा जाए तो तुरंत ठीक किया जा सकता है, वैसे तो उसकी टेस्ट होती नहीं. एंड लास्ट बट नॉट द लीस्ट, इसमें जनरली फैमिली इन्वॉल्व नहीं होता. तो अभी हम लोग जो है वो एक कपल को एम्पावर करने के तौर पर वी ट्राई टू मेक द कपल अंडरस्टैंड कि आपके लाइफ में ये फैक्ट्स हैं. हाउ वुड यू लाइक टू टेक दिस फॉरवर्ड? So this is more a counseling session. Now, as I said, suppose a mother came to us or mother-to-be came to us at 35 years. What are the problems that we see? Now please understand there are certain problems, जैसा मैंने बताया, polycystic ovary ये बहुत common है. इंडिया में the highest incidence of endocrine problem is polycystic ovary. सेकेंड प्रॉब्लम है जो हम अगर थायराइड की ग्रंथि को देखते हैं, और एक और इम्पॉर्टेंट प्रॉब्लम डायबिटिस. अगर आपके फैमिली में किसी को डायबिटिस है, मदर के साइड पे, फादर के साइड पे, आप मतलब लड़की के, तो दैट इज इम्पॉर्टेंट. इट कैन गेट कैरिड फॉरवर्ड और मे कम अप ड्यूरिंग योर प्रेगनेंसी. लास्ट, सपोज हमने ऐसा सोचा कि ये सारी चीजें हमने चेक कर ली, तो ये जरूरी नहीं कि वी हैव गिवन यू सम ट्रीटमेंट, but we have time in our hand to plan. So the take home message is, if you are 35 or even beyond 33, do not waste time. I think it will be important to understand we don't have to panic but plan. So you have to use a different P word. Don't panic, plan and proceed according to that plan. अगर आप proceed उस plan से करते हो तो more likely you will be happy with the outcome of a pregnancy which you plan. The last point that I was making was, आजकल हमारे family sizes छोटे हो गए, तो हमको ये नहीं है कि हमें 10 बच्चे चाहिए. But when we are planning for a pregnancy, we want maybe 1 or a maximum of 2 babies. We want them to be healthy. So I'm coming to this part, which is now being answered. I was asked a question by Madhvi, who was attending my last session for thyroid problems. Why is 35 years के बाद important? The importance is that, as I was telling you, the quality of the eggs in the woman starts going down. If this happens, abnormalities are known to occur. That means बच्चे में जो abnormalities 35 के पहले आने वाले थे, उसके chances बहुत कम थे. 35 के बाद वो chances बढ़ जाते हैं. So हमें ये देखना है कि 35 के एज के बाद प्रॉब्लम ना हो और हमारे अंडे की क्वालिटी अच्छी अगर हो, आई थिंक इट वुड बी अप्रोप्रिएट. सो फार वी हैव डिस्कस्ड व्हाई एज इन अ वुमन इज इम्पोर्टेंट. एवरीवन इज इंडिविजुअलाइज्ड. ऐसा जरूरी नहीं कि हर एक जो है वो 35 के ऊपर का प्रॉब्लम फेस करेगा या उनके अंडों की क्वालिटी पुअर है. तो दिस इज एग्जैक्टली वेयर अ डॉक्टर और अ स्पेशलिस्ट कैन हेल्प यू. इफ यू आर इन दैट कैटेगरी हु रिक्वायर्स हेल्प, then I think it is time we should be willing to take quick steps that can be in the form of treatment or otherwise. So let us say you are over 35. What other problems can happen? Like I said, endocrines के हमने अभी डिस्कस किया. एक बीमारी है जिसको एंडोमेट्रियोसिस ऐसा हम कहते हैं. ये एंडोमेट्रियोसिस वाली बीमारी तब तक पकड़ी नहीं जा सकती जब तक कि हम उसका शक नहीं करते, और इसे देखने के लिए हमें लैप्रोस्कोपी, दूरबीन का एक मुआयना करना पड़ता है. तो वहां तक बात पहुंचने के पहले हम कुछ सिम्टम्स, उनके सवाल जवाब पे से हमको पता चलेगा कि क्या इस बहन को वो प्रॉब्लम है या नहीं. तो ये भी चीजें उस वक्त पे पकड़ी जा सकती है. अगर अ वुमन इज एट 35 एंड शी हैज एंडोमेट्रियोसिस, वी डोंट वेस्ट टाइम. सो बेसिकली यू विल हैव 2 कैटेगरी ऑफ पेशेंट्स. Once you are 30 or beyond, let us say 32 or 33, we will give you time. We say please wait, but plan a pregnancy within the next 2 years. Suppose you can't, then accordingly steps लिए जाते हैं. Now if incidentally इस वक्त के स्क्रीनिंग में हमें कोई डिसीज दिखाई दिया सोनोग्राफी पे, फॉर एग्जाम्पल हम सस्पेक्ट कर रहे हैं कि एंडोमेट्रियोसिस है, then don't ignore it. We tell you quickly start trying to have a baby. कईयों में तो immediately post marriage हमें आगे बढ़ना पड़ता है. So that means if you want to have a baby at 35, the chances of any abnormality and complications both to you and to your baby are lower if you are younger. Abnormalities बच्चे में आने के chances बढ़ जाते हैं as you approach 40. 40 के बाद generally things like Down syndrome, defects of the brain and spinal column are very commonly seen. बहुत सारी चीजें चेक की जा सकती पर उम्र घटाई नहीं जा सकती. So suppose a woman is 35. Suppose she came to us and she is pregnant. Now what are the things that we do? So usually if first trimester, मतलब first 3 months की हम बात करते हैं, अगर मान लीजिएगा first trimester में हमने उनका evaluation किया, तो why is it important? आप कहेंगे कि हमारे पहले ज़माने में कुछ देखते नहीं थे, दिखाना नहीं पड़ता था, डॉक्टर को सीधा जो है वो तीसरा महीना पूरा होने के बाद देखते थे. ये गलत है. Because in the first trimester हम एक पहला डिटेल्ड हिस्ट्री के बाद में एक सोनोग्राफी होती है। सोनोग्राफी के बाद में अबाउट 10 to 12 वीक्स के बीच में एक एंटी स्कैन नाम की सोनोग्राफी होती है, जिसमें बच्चे में कोई खामी या गुंजाइश प्रॉब्लम की तुरंत हमें पता चलती है। सो दिस सोनोग्राफी इज इम्पॉर्टेंट अराउंड 12 वीक्स। इसके साथ में एक बेसिक जो है वो ब्लड वर्क इवैल्यूएशन होता है। किसी को थायराइड की बीमारी होती है, किसी को भविष्य में डायबिटीज होने वाला होता है, किसी को जो है वो एनीमिया होता है, वो इसी वक्त पे हम करेक्ट करें तो सबसे अच्छा। इसी समय हमारे और डिटेल्ड इवैल्यूएशन होते हैं, जिसमें हम डायटिशियन के साथ इनको बात करनी कहते हैं। अगर मान लो ये बहन को प्रीवियस हिस्ट्री अबॉर्शन की है या प्रीवियस हिस्ट्री है किसी तरह का कोई भी यूरिन का इन्फेक्शन या ऐसा, तो उसे बार बार बुलाया जाता है। सो बेस्ड ऑन हमारी किन बहनों को क्या तकलीफ है, उस बेसिस पे हम डिसाइड करते हैं हाउ टू गो अबाउट इट। सो दिस इज वन पार्ट विच वी हैव टू बी क्लियर अबाउट। सेकेंडली, अगर मान इनको कभी ब्लीडिंग हो गया, सो दिस इज ऑफन अ क्वेश्चन विच इज आस्क्ड, फर्स्ट 3 months में अगर कहीं पे ब्लीडिंग हुआ तो डू नॉट वेस्ट टाइम, प्लीज सी द डॉक्टर, बिकॉज करेक्टिव मेजर्स अगर यहाँ सही कर दिए गए तो मोस्ट टाइम्स आउटकम अच्छा होता है। खास करके इन लोगों के लिए इंपॉर्टेंट है जिनको पहले ये ऑलरेडी हो चुका है। थर्ड थिंग, यहाँ पे ही एक ब्लड टेस्ट की जाती है जनरली 12 वीक्स के आसपास, 14 वीक्स तक, मतलब 3 महीने के आसपास। इसे हम डबल मार्कर कहते हैं। डबल मार्कर करने पर हमें पक्का पता चलता है कि वेदर हमारे बच्चे में कोई खामी होने की गुंजाइश है या नहीं। तो जैसा मैंने एंटी स्कैन बताया आपको सोनोग्राफी, वैसे ही ये डबल मार्कर का इंपॉर्टेंस है। डबल मार्कर विल टेल अस वेदर यू आर लाइकली टू हैव एनी प्रॉब्लम रिलेटेड टू द बेबी इनसाइड योर टमी। सो अकॉर्डिंगली स्टेप्स कैन बी टेकन। कई बार हमको लोग पूछते हैं क्रोमोसोमल डिफेक्ट्स के बारे में क्या हमें पता चलता है। यस, क्रोमोसोमल डिफेक्ट्स वी कैन नो अर्ली, पर उन्हीं में किया जाता है जिसकी जरूरत है। सो एवरीबडी एंटरिंग अ वेटिंग रूम does not have the same history. There will be different ways of treating different people. So it is important to meet your obstetrician in the first 12 weeks. He may or she may call you more often. Now what we will do is, now we will go from there to the second trimester, मतलब second part starting from 12 weeks to 18 weeks. यहाँ पे जनरली ऐसे ही वो जो डबल मार्कर किया वैसे क्वाड्रुपल मार्कर किया जाता है। एक और चीज होती है जो 4th और 5th मंथ के बीच में की जाती है, जिसे एनामली स्कैन कहते हैं। एक सोनोग्राफी होती है, बहुत डिटेल होती है, जिसमें हमें पता चलता है कि बच्चे में और कोई डिफेक्ट्स है या नहीं। सोनोग्राफी इतनी डिटेल होती है, सारे छोटे छोटे चीजें, स्मॉल थिंग्स आर पिक्ड अप एट दिस पॉइंट ऑफ टाइम। इट इज ऑल्सो इम्पॉर्टेंट कि बाद में ये बहन को डायबिटीज होने वाला होगा, जिसे हम जेस्टेशनल डायबिटीज कहते हैं, वो होगा या नहीं। थर्ड, अगर मान लो उसको एक्सरसाइज और डाइट के बारे में मुझे एडवाइस करना है तो इस वक्त पे उसे किया जाता है एडवाइस। फाइनली वी विल रीच द लास्ट 3 months. अब इस बार लेट अस अज्यूम शी इज अ फर्स्ट टाइम. Let us say the first time she has a tendency to high blood pressure. So what are the problems of a 35-year-old and above? The common problems that we see are, one, उनके बच्चे की ग्रोथ छोटी होगी. This is related to the baby. You might have a preterm delivery. You may have a problem called stillbirth जो हो सकता है. So you have to be very careful and very consistent with your follow-up with your doctors. Then the high blood pressure thing starts round about 7th and 8th month. So you should be able to go to your doctors and find out whether ये होने का chance है. Accordingly, the doctor will change or give you medication. He might restrict or she might restrict the salt you take in your diet. Lastly, labor-related complications are very common. 35 and above, you may have abnormality while not only going for labor, delivery के वक्त पे भी problem हो सकता है कि आपकी normal delivery ना हो या तकलीफ हो सकता है कि अपनी बॉडी की इलास्टिक टिश्यूज उतनी अच्छी ना हो, एंड देयर आर अ चांस दैट सिजेरियन हो सकता है. अब एक मिनट का मैं वक्त लूंगा. अगर आपका फर्स्ट बच्चा ऑलरेडी हो चुका है एंड दिस इज द सेकंड टाइम व्हेन यू आर कंसीविंग, मोर और लेस द डॉक्टर फील्स कंफर्टेबल कि एक बार हम ये पहाड़ चढ़ चुके हैं, लेकिन ये जरूरी नहीं कि दूसरी बार हमारा सिजेरियन नहीं होगा अगर पहली बार हुआ है तो. सो ऑफन दिस इज आस्क्ड. सो what are the things we have to look out for? Elderly mother 35 and above is somebody who is prone to 4-5 complications. About a few to the mother की complications होंगे, high blood pressure related called eclampsia या pre-eclampsia. मतलब इसको हम लोग high blood pressure कहते हैं, वेट गेन बहुत हो रहा है, सडनली पैरों में सूजन आ जाती है, या फिर लेबर रिलेटेड प्रॉब्लम्स आ सकते हैं, बच्चे की ग्रोथ स्लो डाउन हो सकती है, या फिर डॉक्टर्स आर विलिंग टू चेक एंड टेल यू अगर कुछ कॉम्प्लिकेशंस हो रहे हैं. सो 35 एंड अबव, डू नॉट इग्नोर. Now, I will come next to the final part of this discussion, where let us say a 35-year-old woman comes in and says that I have conceived. Do all those women have to go through a cesarean section? No. Is it possible that when we come for infertility treatment, उनके लिए ये बहुत प्रेशियस प्रेगनेंसी होती है, तो दे आर वेरी एंक्शियस मदर्स. इनको कितना रेस्ट की जरूरत है, हाउ मच दे नीड टू गो टू ऑफिस, वेदर दे कैन अटेंड और नॉट, that we can see. So I think I have covered a major portion of what are the complications. Just to sum it up, if you're 35 and above, please do not wait too long. 1 year waiting is all you can take. Uske baad mein, please think in terms of having a baby. We have plenty of women who come to us at the age of 40 saying, अब हमें बच्चा चाहिए. Financially भी अगर आप समझते हो कि you have problems, do not waste time. If you come to me for infertility treatment at 40, my hands are tied as a doctor. But if you come to me at 35, I have 25 other ways. You'll be surprised, 85% pregnancies can be achieved if you are between 35 and 40 years of age, if you come to us on time. The same thing becomes impossible after 40. So 35 to 40, coming on time, taking treatment on time, very important. I think what I want to do is see if there can be some questions I can take. So let's check that thing, right? We have a question from Divya. She says, I'm 36. Is it safe to have a pregnancy at this age? And will I need supplements to take? Please consider my question as because the first autistic child. Yes, it is important. Your autism in the child is not related to this, and she has said, I would not मतलब बच्चा पहला जो हुआ था तो उसकी वजह से is it possible, should I be worried? Partially yes, but generally autism may not be present in both the babies. It is known that autism is related to the father's side, ऐसा माना जाता है. We are not sure, research is still going on. So I hope I cannot answer your question, but yes, you should seek a good counselor, or for that matter, a good obstetrician, and he'll be able to tell you. Indu Nagwal is asking me, sir, important, sorry, I was 14 June. I took test and there was faint line under my dark. Okay, वो urine pregnancy test ली थी इन्होंने. Okay, what she is saying is there is a spotting, and am I pregnant or not? So in this case, what you need to see is your doctor. Do not rely only on your urine pregnancy test for answers. Then, as has been explained, I have taken time to try and explain the processes. So as you send me more questions, I'll be able to answer. But I'll go back to my basic EA, because I want you to understand, ये discussion is not just a discussion about whether it is 35 or not. This can be a general discussion. So if you have a history of previous abortions, which happened in the first trimester, that means in the first 12 weeks of pregnancy, don't ignore it. It can be repetitive. If on top of that you're about 35, it's more dangerous. Suppose you have a thyroid problem. Suppose you have polycystic ovary. Suppose you have endometriosis. All these are added complications which get increased if you're about 35. Diabetes is known to increase. It's called gestational diabetes. So you have to treat diabetes early on. Sometimes this diabetes doesn't stay with you. Third thing that you have to remember is, if you are an elderly person, will you only have a chance of abnormality? So there are enough tests that we can do to confirm if there is any abnormality or not. So it is not necessary that we will end up having only abnormalities. So I think a doctor now is much better placed to find out whether there are any abnormalities. Now the question of supplements. You see, main source of your food, how you eat and what you eat can decide how we end up with our pregnancy. But there are certain things that can't be changed with just food. For example, if a woman has a thyroid related problem, the thyroid related problem has to be corrected, and we have to constantly watch and monitor whether it is getting corrected or not, or is there anything else we can do. Now, let us say cesarean and other complications. Usually, when you have conceived after 35 years, you are also the anxious type. You are not the one who is willing to take a chance. But often enough, it is possible you'll deliver normally. So, अगर आपका उस वक्त पे बच्चा breech presentation में है, पैरों के बल है, अगर if your baby is oblique, if there is any abnormality or if the placenta is low lying, a doctor may suggest a cesarean section. Beyond a certain point, there is not too much leeway to try many stunts. So I feel we should be willing to undergo certain tests and completely trust the doctor with it. Now, let me go back to the topic that I was discussing of whether we should have a strategy. So I will have a strategy जिसमें a woman should start early planning for a baby. One small point I wanted to discuss here. Often enough, women come to us and say that I have not yet decided to get married, but I will get married. Is it possible for me to store my eggs? Now, this is something you will read about. Yes, that facility is available with us. We in Siddhi Life IVF are a Government of India recognized IVF center. So we get requests for this. It is not very easy, nor is it very reliable. They say we can marry later. It is not for marrying later. In some cases, your eggs can be stored in such a way that in case at a later point you find any abnormality, these can be utilized. Social egg freezing. This social egg freezing is something which some companies give as an offer. They say, we will freeze your eggs, you can continue with your career. We don't want you to get pregnant just now. I don't know how far this is right or not. Generally, we don't say that is an alternative to conceiving in time. So we are not too much in favor of saying egg freezing for everybody. I hope that is understood. Second, suppose a woman comes to us and says, I have to conceive. We feel that we will not just guide you through the fact that you should conceive and do it fast or slow, but we will also help you at the time of delivery. Which means complications related to your process of conceiving se leke till you deliver should be handled by one set of doctors. It should not be कि हर बार आपको अलग-अलग जगह पे जाना पड़े. Finally, suppose I have a person who comes to me at 35, just been married for a year. We already know कि we have to optimize that treatment. Optimize करना मतलब ये होता है कि you tell that person, I will try and see that we improve your chances every month for you to conceive. It may not be very advanced treatment. It may not be IVF. It may be simple treatment like IUI. It may be not even IUI. It may be just ovulation period जो है वो check करके हम बताएंगे कौन से दिन आपका सही अंडा निकल रहा है. अगर if we can guide you like that, even then you can achieve a pregnancy faster. A lot of new advances have taken place. Medicine is progressing very rapidly, but it does not mean that unless you come and benefit from that knowledge, we can help you in any way. So I thought it was important to talk about this. It was important to plan. You may actually be a mother after 35. So what are the things you can do? One, see to it that you very diligently follow the advice of your doctors. Do not try and skip any visits as far as possible. If you, for various reasons, ekadi visit aap kar nahi paye, to reschedule it. Because every time of your pregnancy during the 9 months, we have to do a specific set of tests. So even if you're staying far off, try to reschedule your appointment. Third thing is, you will need all the emotional support you can get from your husband at this point of time. Generally, if your marriage is late or you have delayed your pregnancy, This is one time when you are an independent person and suddenly you need help. So you bond very well with your husband, with your family members. So you will need family support at this time. A dietitian's advice is very important. Your doctor, the obstetrician आपका जो होता है, gynecologist जो होता है, that person has to be aware of what are the problems after 35. In our setup, for example, when you go to our website www.siddhilifeivf.com, you'll find a lot of testimonials of doctors, of patients who will tell you that we were over 35 and we were healthy. So treatment does not necessarily mean कि सीधे सीधे आपको IVF करना है. It may mean a simple way to go into it. Now suppose you have conceived like that with some fertility treatment. Again, it does not mean कि आपकी delivery जो है वो complicated है. It is just that you conceived late. So logically speaking, हमारे career को साथ में लेकर कैसे हम manage कर सकते हैं is what we have to do. Third thing, suppose you have had a previous history of, let us say, any problem, any complication, as has been mentioned. So what are the things you have to take care of? We have to figure out whether हमारा ये problem दोबारा होगा या नहीं. For example, a simple thing that we commonly see is called as IUGR, intrauterine growth retardation. बच्चे का वजन थोड़ा कम रह जाता है. ये जरूरी नहीं कि अगले बार भी रिपीट होगा. अगर आपकी प्रीवियस हिस्ट्री है अबॉर्शन की, जरूरी नहीं कि वो अबॉर्शन इस बार भी होगा, but you are obviously very tense. You can't take it lightly. So this is the correct approach. A doctor will more or less help you understand whether right now everything is going on well or not. We will like to take more number of questions if possible. But I thought along with that, let us say the elderly age group in India should not be restricted to 35 and above. एक टर्म मैंने पढ़ी, इट इज कॉल्ड जीरियाट्रिक प्रेगनेंसी. ये बहुत भद्दी है टर्म, मुझे अच्छी नहीं लगी. जीरियाट्रिक मतलब बहुत बुढ़ापा ऐसा बताया जाता है. सो आई डोंट थिंक आई एग्री विद जीरियाट्रिक एज अ वर्ड. बट लेट मी गो एंड टेल यू कि मेरे यहाँ पे, मैं जहाँ इनफर्टिलिटी प्रैक्टिस करता हूँ, वहाँ पे हमारा जो सेंटर है, वहाँ पे वी सी वीमेन हु आर अबव 40, even above 45, who have tried to conceive and they have conceived. Now the problems with them are different. They have conceived with assisted reproduction. उनको मुझे IVF या ऐसे बड़े प्रोसीजर्स की जरूरत पड़ी. लेकिन जो 35 से 40 के बीच में होते हैं, जनरली इनका आउटकम अगर सही टाइट मॉनिटरिंग किया तो बहुत अच्छी तरह से हो सकता है. नाउ द सेकेंड ट्राइमेस्टर, कई एबनॉर्मैलिटीज जो होती है वो यहाँ डिटेक्ट होती है, बट प्रेगनेंसी रिलेटेड कॉम्प्लिकेशंस नहीं होते. तो इफ अ वुमन इज डूइंग हर जॉब, शी नीड नॉट प्रोसीड ऑन लीव एट दिस पॉइंट ऑफ टाइम. शी कैन ओनली टेक केयर ऑफ थिंग्स विद डाइट एंड अ फ्यू मेडिकेशंस. जब इनफर्टिलिटी की ट्रीटमेंट होती है तो जनरली वो 12 वीक्स मतलब फर्स्ट 3 महीने तक चलती है. इसके बाद दवाइयाँ कम हो जाती है. सो इनफर्टिलिटी ट्रीटमेंट वाले भी 35 ईयर ओल्ड और अ वुमन हु इज above 35 and has not taken any fertility treatment is fine. So we can do that very easily. अगर मान लो हम थर्ड ट्राइमेस्टर की बात करते हैं, मतलब लास्ट 3 मंथ्स. सो लास्ट 3 मंथ्स में हमारा कांस्टेंट वॉच होता है कि बच्चे का वजन क्या होगा, मदर में कोई कॉम्प्लिकेशन होगी या नहीं, और जहां जहां चाहिए वहां दवाइयां ऐड या सब्सट्रैक्ट की जाती है. सो इंजेक्शंस देने से लेकर कुछ स्पेशलाइज्ड ट्रीटमेंट देना, ये सारी चीजें जो है वो डिपेंड करती है किसको उसकी जरूरत है. सो होपफुली आई फील वी हैव ट्राइड टू टैकल योर प्रॉब्लम एंड वी फील कि अब ये डिस्कशन एक ही इसमें खत्म नहीं होता, बिकॉज एवरीबडी हैज स्पेसिफिक प्रॉब्लम्स. एवरीबडीज प्रॉब्लम कांट बी पुट इन वन बास्केट. वी फील कि चांसेस ऑफ अ सिजेरियन, चांसेस रिलेटेड टू एनी आउटकम दैट इज डिफरेंट, ये बढ़ जाता है. Now let me talk of a little bit about if your baby is born prematurely, what will happen. Neonatal intensive care unit में रखना पड़ता है, कुछ इंजेक्शंस दवाइयाँ देनी पड़ती है जिससे बच्चे के लंग्स अच्छे हो सकते हैं. कई बार हमारे यहाँ ट्विन प्रेगनेंसी जो है वो रह जाती है, इनमें बच्चे प्रीमेच्योर होते हैं. कई बार ये ओवर 35 ईयर की बहनें जो होती हैं, इनको ट्विन प्रेगनेंसी रह जाती है. तो इन शॉर्ट दिस इज कॉल्ड एज नॉट हाई रिस्क ऑब्स्टेट्रिक, स्पेशल रिस्क ऑब्स्टेट्रिक्स. मतलब जिनकी डिलीवरी में हम कोई एंटिसिपेट कर रहे हैं प्रॉब्लम, उसको सही सही इलाज अगर किया जाए, सो वी कैन ट्रीट देम. नाउ let us say that most of my questions I have answered, but if I have to answer any specific questions, Varsha has said, hello doctor, nice to see you again and very interesting topic. Thank you Varsha for your kind words. Madhvi had asked me, is it safe to have your second child after 35? Yes, Madhvi, I believe you have had a first child. If there has been no complications, then there should not be any problem. I think we have also discussed what are the complications. बहुत सारे हमने discuss किए हैं. अगर पूछना है कुछ आपको, तो yes, you can ask. I will be giving you my website www.siddhilife5f.com, or you can log on to BabyChakra. They'll forward it to me, and we can guide you through that. If there are other questions related to a over 35-year-old. Now, sometimes one point gets forgotten, that if you have already got diabetes, if you already are a PCOS, if you have a thyroid problem, will it be safe? So don't worry, don't be anxious. All these problems can be overcome. All you need is proper medication at the right time. Do not feel that you need to worry and therefore delay it further. So what is my advice is, if you're already 36 or 37, by waiting another year because you are tense, you're not going to decrease your chances of a complication. In fact, see a doctor. So your worries should be answered, and I think prevention is better than cure, is what we stress. Suppose you are already in the 35 to 40 age group category. We take extra care. The outcome is very good in our setup. We have seen a lot of these girls over the last 25 to 30 years in practice. We feel we can be confident that most times the outcome can be good. Yes, we need a backup of a neonatal intensive care unit. हमारे यहाँ जब delivery होती है तो a child specialist always is in the campus, on the site, inside the operation theatre. So the baby can be looked after from there. But according to me, अगर आप पहले से ही anticipate करके कोई चीज को solve करो, so it is better than curing it afterwards. There were lots of questions which we usually like to handle. Suppose you have severe anemia, तो क्या हो सकता है? तो ये सारे added complications है. Above 35 itself is a problem. इसमें कोई add-on अगर हो जाता है problem, so we will end up having trouble. Therefore, a doctor may call you more often for your visits. A doctor has to be qualified and good to be able to take care of you. So my advice to you is, if you're over 35 and you do not intend anyway to have too many kids, so there is no reason why you can't set aside time for your medical treatment. You have to plan. You have to plan in such a way that your career can probably take a backseat for the short period of time. Maybe the doctor will arrange in such a way. We have many girls who come to us who work almost till the last day of their pregnancy because they're physically fit. So we do not discourage them from work. It is a misconception that you listen to only certain people who do not know what the topic is and they guide you. It is better that a qualified person guides you. We take on board a lot of people. We take on board people who have advice to give, but the advice has to be scientifically correct and it should help both the baby and the mother. So I think with doctors, a patient has to form what is called as a bond of trust. Once you have this bond of trust, you'll start following the advice. Some things you can do, some things you can't do. We wish everybody who is above 35 a very healthy outcome. It is possible, we can't promise it to everyone. But my personal experience over the last 25 to 30 years has been that whoever has sought treatment on time, has taken proper corrective and preventive measures, generally the outcome is good. Do not feel that all 35-year-olds will have a problem. Finally, I wanted to just sum up about endocrine problems, which I had spoken of earlier. The endocrine problems that we are talking of are related to a woman and they may not cause a complication. Suppose they are present, does it mean you have to be scared? For example, people ask me, thyroid की दवाई अगर हम ले रहे हैं तो क्या जिंदगी भर लेनी पड़ेगी? Not necessary. So dynamics during pregnancy are different. Exercise के बारे में जब मुझे पूछा जाता है तो हम लोग generally very aggressive exercises नहीं suggest. Suppose you have some surgery which you have already undergone on your stomach. Suppose there is something related to your fertility organs that has happened. Do not ignore it. The best person to guide you is your doctor. I feel this topic was chosen, the initiative was taken because we see a lot of girls above 35. If you are a first-time mother or a would-be mother, please listen to this conversation, because I think this is like somebody telling you when not to waste time. Maybe you have other ways of looking at it. We have touched upon various topics, including social egg freezing, which may be more or less something जो नहीं चाहते हैं. और अगर you are in the age of 40 or between 35 and 40, the chances of having a Down syndrome baby, the chances of having an abnormal baby are almost 400 times increased when you hit 40. So suppose you had a chance to go for a pregnancy at 37 or 38, I would advise you to look at that option rather than wait for 40, because your egg quality starts going down. Fertility advances are so good that we have had mothers. मेरे यहाँ clinic में we have had a patient of 42 conceived with her own eggs, healthy baby, went home. Now this can happen as an exception. So everybody may have what is called as an age-related आधार कार्ड. वैसे आपकी ovaries and reproductive organ का भी एक आधार कार्ड होता है, उसका भी एक एज होता है, वो कम या ज़्यादा हो सकता है. The whole talk is geared to help you understand that our job as doctors, as obstetricians, is to take you from point A to point B, which means एक healthy माँ और healthy baby आपको मिलना चाहिए, irrespective of your age. So do not worry. It is just that our way of dealing with it will be different. Last but not the least, there is a group of people whom you can connect with, who will help you. So if ever there is any reason for you to feel there is a question that needs to be asked, I'm sure you can post it on BabyChakra. I'll just check right now if there is any more questions that there are. I think about supplements, Divya has asked. You see, supplements, अगर मान लीजिएगा आप ज़्यादा लेते हो या कम लेते हो, तो ये आपके हाथ में नहीं है. Your doctors will give you the correct supplements that you need. You will be given iron, you will be given calcium in your second and third trimester. There are certain additional things which are given which improve the chances of what is called as a healthy outcome, which your doctors will decide best for you. Third thing, what are the signs that you should look out for? So this I generally tell women who come to us, how would you be careful? Please understand 3 things in the third trimester that are important. Any fever, अब के ज़माने में तो we are thinking of COVID etc. But any fever should not be ignored. You may be actually thinking ये कुछ नहीं है, 2 क्रोसिन खा लेंगे ठीक हो जाएगा, ऐसा नहीं है. It may be sign of an infection. अगर आपके 8 months की pregnancy है तो आप prematurely deliver करोगे, तो please take that to your doctor, get it examined and get it treated. Second, यूरिन के इन्फेक्शंस बहुत कॉमन होते हैं अबाउट 35 के बाद भी और ऊपर 30 से 35 और एनी प्रेग्नेंट वुमन. डोंट इग्नोर इट. हम इसको एसिम्प्टोमेटिक बैक्टीरियोरिया कहते हैं. आपको पता भी नहीं चलेगा आपको इन्फेक्शन है, लेकिन उस इन्फेक्शन की वजह से आपको डिलीवरी जल्दी हो सकती है. अगर मान लीजिएगा आपको बॉडीली स्ट्रेन ज़्यादा हो रहा है, आपको बहुत थकान महसूस हो रही है, especially in the third trimester, don't ignore it. Bring it to the notice of your doctor. There will be certain blood tests by which we can find out whether anything is wrong with you. Certain blood tests including karyotyping. एक स्टेप होती है जिसमें हम बच्चे के आजू बाजू का पानी निकाल के एक मुआयने के लिए भेजते हैं. दिस इज कॉल्ड एज क्रोमोसोम टेस्टिंग. ये खास केवल बच्चे में जिसको अबनॉर्मैलिटी होती है उन्हीं के लिए किया जाता है. नाउ अरुण वर्मा हैज आस्क्ड, यूरिन नहीं रुकती है, जाते हैं तो प्रॉब्लम हो सकता है. यस अरुण, आपको इसको इग्नोर नहीं करना है आपकी मिसेस के बारे में, बिकॉज अगर बार बार यूरिन होता है तो 2 चीज़ें हो सकती हैं. एक की वो जनरली प्रेगनेंसी में होता है, लेकिन अगर बार बार यूरिन हो रही है तो ये लक्षण हो सकता है डायबिटीज का. ये भी हो सकता है कि यूरिन का इन्फेक्शन है जो इग्नोर किया जाता है. सो बोथ वेज प्लीज डोंट इग्नोर इट. Then I think we have one more question. Doctor, we don't know last period date correctly. How can I find out when did I actually get pregnant? Because my ठीक है, ये वाला प्रॉब्लम काफी कॉमन है. हमें ये जरूरी नहीं कि एग्जैक्ट डेट जानना जरूरी होगा. सोनोग्राफी से हम काफी हद तक ट्रैक कर सकते हैं. Yes, the date can be wrong by a week or so, but anywhere from 36 to 38 weeks is considered a normal, healthy outcome if you deliver. So ये जरूरी नहीं कि exactly 40 weeks पूरे होने पर ही आप deliver करते हैं. Now, I think किसी ने लिखा है, I have a pregnancy at that age. Do I need supplements? I think I've answered that question. Somebody has mentioned the LMP was on 15th July. I took a test and there was a faint line. I think I have answered that. ये pregnancy है या नहीं ये भी हम नहीं जानते. So I hope most of your questions we have been able to answer. Shall we now say that complications related to the mother and child become more if you are about 35. Pregnancy itself will require close monitoring. Most of the times, the outcome will be good. Do not forget that in this time when the virus COVID has caused havoc in the world, we should forget the most important things that are also to be done and which have to be religiously done. They are, please wash your hands for 20 seconds, at least 8 to 10 or more number of times, especially when you go out and come in. This is an easy way to prevent the disease. Do not touch your hands to your face unnecessarily, especially if you're pregnant. Avoid going out unnecessarily. And most important, please wear a mask. Follow social distancing norms. They are for your good. As doctors, we can only do very little. We have tried our best. All of us out there are working hard to prevent this happening to everybody. So I hope we have been able to, put up an interesting session. And if there are still questions which you want to ask, I think we would like to now take forward ये blood pressure related problem जो हम लोग देखते हैं. अब the good news is that if you are even above 35 or not, you can still end up having blood pressure which goes up from the 7th month. This is because the kidneys of the mother are put under pressure. There are two people जिनका वो kidney clear up कर रही है. एक होगा बच्चे का और एक आपका खुद का. तो यहाँ पे नमक ज़्यादा ना खाना, जहाँ ज़रूरत है वहाँ ब्लड प्रेशर की गोलियाँ लेना, and to see to it that sometimes our delivery takes place on time is important. So one thing you will have to understand is your doctor probably will be the best person to guide you. It is very easy for me to say ये ऐसा होना चाहिए या वैसा. I don't think that is the correct approach. Also, suppose labor या delivery में problems आते हैं, तो 35 के बाद जनरली हमारा बोन स्ट्रक्चर जो है उसमें भी थोड़ी रिजिडिटी आती है, तो नॉर्मल डिलीवरी के चांसेस थोड़े कम होते हैं. स्टैटिस्टिकल एनालिसिस में अगर आपको करके दो और ये कहूँ कि 10 बहनें जो 35 के ऊपर थी उनमें से 9 बहनों को तकलीफ नहीं हुई, तो आप आपकी केस देखें. यू शुड लुक एट योर केस. इज देयर एनी कॉम्प्लिकेशन दैट विल हैपन? लास्टली, द साइंस ऑफ बोथ नियोनेटोलॉजी, बच्चों का एंड ऑब्स्टेट्रिक्स, हैज प्रोग्रेस्ड फार एंड वाइड. कई बार ऐसा होता है कि वी डोंट नीड टू डू एनीथिंग हीरोइक. आई थिंक वी हैव कम टू अ पॉइंट वेयर वुमेन कम टू अस. सो इनफर्टिलिटी के बारे में अब मैं बताऊंगा. हो सकता है कि somebody is getting married late. हो सकता है कि they are not planning a baby. I think our job is to make them aware कि don't ignore this facet. ये बात हाइड करने जैसी कुछ नहीं, बात करनी चाहिए इसके बारे में. सेकेंडली, अगर कोई ब्लड टेस्ट या काउंसलिंग होता है तो कुछ बुरा नहीं है, आप प्लान करके आगे जा रहे हो. forewarned is forearmed. अगर आगे जाके आप प्रेगनेंसी के लिए जाते हो तो ये प्रेगनेंसी को देखने का नजरिया डॉक्टर का अलग होगा. दैट डजंट मैटर. सो इवन इफ यू स्टार्टेड लेट with your obstetric career, suppose you decided you want to go ahead and have a baby, please don't worry, please don't panic. It is possible you will have a healthy outcome. You're most welcome to log on. You will see a lot of people who have this problem. Then there are other questions related to if I'm 35 and above and I have polycystic ovary, thyroid problem, maybe history of diabetes, history of abortions, or any such thing. Do not give more than 1 year time. More than 1 year after marriage, if you're not conceived and you have been trying, then quickly go ahead and try and have a baby. Take extra precautions in regard to supplements which are recommended by your doctor, food habits which can be improved by a dietitian. Check your thyroid gland and other glands frequently. Hemoglobin, urine are frequently checked by a doctor because he or she wants you to have a favorable outcome. Towards the end, as we approach the 9th month, you have to be extra careful that you do not deliver in a preterm manner. More frequent visits are required. In these times also we see these patients, even if there is a scare that one can have corona. So it doesn't matter, corona or no corona, you have to end up seeing these patients. There are decisions that are taken sometimes related to whether you can have a normal delivery or not. You can discuss this with your doctor. There are a lot of people who can deliver normally. Finally, suppose a patient was to come to us. So the pregnancy in an elderly, the baby is born of this mother's. The good news is, if you have conceived, so as they say, there is always a silver lining to everything. So suppose you say, I am 35 and I'm going to have a baby. I will only look at the positives in this. I've just told you all the negatives. So what is the positive? You're financially better off. You're probably settled down in life. You feel that much more comfortable giving time because this is a precious pregnancy. So I feel it is not such a bad thing to have if you are properly guided, if you take precautions, and there is a family support unit that is present. So just because you're having a pregnancy after 35 and you're elderly doesn't mean the outcome is bad. The joy of holding your child remains the same. And I'm sure all mothers above 35 are as happy to have a child and look after the child as a woman who conceives and delivers early. So just that you have to be extra careful. A final point that I like to make is about the father's age and his fertility potential. Yes, age also affects the male. His fertility potential also goes down. So what is the cutoff point, you will say? I'm sorry to say that even today, the world has not discovered a way by which we can start producing eggs in a woman after 40. So when you are 35, don't start looking at your actual age and saying abhi time hai. Start looking at it as केवल 5 साल बचे हैं, केवल 3 साल बचे, केवल 2 साल. Start thinking like that, then mentally you will get in a better space. If you have had previous surgery, if you have had a previous cesarean, and you are above 35, there is a possibility, a higher possibility that you will require surgery. Yes, there are complications, but if planned properly, there should not be any. And finally, about the babies. The babies born for women who are above 35, if there have been no other abnormalities that we have already checked, there is no reason why your baby is not going to be healthy. Your baby is going to be as healthy as any other woman. So just because you are elder by maybe 3 or 4 or 5 years does not mean the outcome is going to be bad. So I hope a difficult topic has been covered, and there may be other questions you have. You can always log on to my Facebook page, or you can log on to other social media platforms that we are on. Our website is www.siddhilifeivf.com. You're welcome to come in and talk to us or go in details. There is one final set of questions I'd like to take. I think Kiran Kanojia is asking us, during these COVID times, if you're planning to conceive, when do we need to visit the hospital? Is there guidelines specified in COVID-19 times? Well, the answer is no. The COVID guidelines are about treatment which we give. Now, I don't know, Kiran, in your case, how many years you've been married and what is your age. But people are conceiving in COVID times. It is only that you have to be extra careful. Direct correlation, COVID ka, if you get it, then it is trouble. But otherwise, there are no guidelines, except that If you are planning it when you're in the midst of the pandemic, maybe you can postpone it. This is what the guidelines are in a general manner. They are not specific for you. So I think before I answer Kiran's question, I would like to know what is your age. And finally, I think we have to look at the possibility of supplements. So, ये supplement वाला question जो था, generally what happens is there are certain supplements which are given to the mother to be or mother. There is also treatment which we give a mother to be. That means she's still to conceive. Here we start giving them certain fertility related pills and we encourage them to have a baby. Now this treatment may be slow, but at least we are not rushing into major treatment. So 35, I was coming to that part. The alarm bells for girls should be ringing at 35. Your fertility potential is decreasing. Your chances of having a healthy baby are decreasing. If you want to delay, try and be aware of what are the complications. Meet your doctor if you can. Talk to your husband. I'm sure both of you can come to some conclusion. Suppose you have conceived after 35. It does not mean there is a problem in all cases. Specific problems like, let us say, complications of a particular case are dealt with at an individual level. 35 years is not a cutoff, but 35 to 40, at least you should have that child which you want is what we recommend. Because when you come to us at the age of 40, even if we try, it is very difficult for us to give a good outcome for your treatment. So a healthy mother post 35 is more a distinct possibility in good doctors' hands. We feel confident that you will be having a healthy outcome. Please do not get scared of the outcome. There is always God who is watching over us. And if we have done our things properly, complications can be avoided. Treatment on time is of help. I hope one last time I check if there are any queries and if there is any specific questions that you asked us. If there are, I will probably check and then take it further. I think we are more or less done with most of the questions. I think there is one question which I'd like to answer here on. This is a question which is specific. Mrs. Abi, she is asking me that, doctor, if you don't know last period date correctly, how can I find out? I think I answered part of it. Okay. She's asking me whether her pregnancy, how do you time it? Sometimes a urine pregnancy test may not be very sensitive. In setups like ours, we do not rely entirely on urine pregnancy test. Probably what happens is that a urine pregnancy test can be both false positive and false negative. So do not rely entirely on your blood test. And I think we had been asked that question, ki 36 ke baad, is it possible that we will have a healthy outcome? I think I have answered that question. So I think we take leave from you. I hope it has been of some help, this discussion. And we hope to get feedback from you. I would be more than happy to help you in any which way. You're free to connect on www.siddhilifeivf.com. I must thank BabyChakra for choosing an innovative topic which I had suggested, because this is one topic which generally doesn't get highlighted. So if there is other questions, I can answer them individually. And I hope you have enjoyed this session as much as I have enjoyed it. And I hope all of you have a safe outcome with pregnancy. For those who haven't, if you're above 35, don't waste time. In these COVID times, wash your hands more frequently. Take care of yourself, take care of your family. Social distancing, face mask. Thank you. Have a great day. I have enjoyed this.